In this video, I will be talking about nitrous oxide and how it can be used during your labor for pain relief. Most people know nitrous oxide as laughing gas. You may have had this before at the dentist to help with pain if you've ever had a dental procedure done. Nitrous oxide is a gas that is mixed with oxygen, and it can be used for labor pain by breathing it in through a mask or a mouthpiece. Many women in Europe and other countries around the world have been using nitrous oxide to help cope with pain in labor, and it has been shown to be a safe and effective method of pain relief for many years. Although it is not used as often as in the United States compared to other countries, it has definitely gained more popularity recently. Many facilities, such as hospitals and birth centers, now have nitrous oxide readily available for patients to use during their labor and birth experience. So how do you use nitrous oxide during labor to help with pain management? Special equipment is used to mix the nitrous oxide. The laboring patient will be the one that holds the mask or the mouthpiece and breathes in the gas. Only you can be the one who decides how often you'd like to use it and how much you need. It is the most effective if you can inhale the gas about 30 seconds before your contraction begins, since it takes a little bit of time to get through your entire body. Now, the goal is to have that nitrous oxide working at the peak of your contraction, when it's typically the strongest and the most painful, so that you get the most relief. Some people find that using nitrous oxide during labor helps take off the edge a little bit when their contractions are the most intense. It doesn't completely get rid of the pain, but it can help to cope with the pain a little bit better. But not everyone loves the way that nitrous makes them feel. Some people feel drowsy, lightheaded, or dizzy. Sometimes it could even make you feel a little bit silly, which is where it got that name, laughing gas. And in rare circumstances, it can make you feel restless or confused. The nice thing about nitrous oxide is that it leaves your body really quickly by breathing it out. So if you don't like the way that it makes you feel, that feeling typically doesn't last very long. If you're using nitrous, no extra monitoring is necessary. It's safe for you and your baby, and using nitrous oxide doesn't affect your labor process, meaning it doesn't speed it up and it doesn't slow it down. There are a few reasons that using nitrous oxide may not be safe for you, such as if you have pernicious anemia, take vitamin B12 supplements, or if your provider finds that you have any medical conditions that it may not be safe to use. Depending on where you choose to give birth, different facilities may have different policies about how nitrous oxide is used. Some places may allow you to use it when you're in the tub, but others may not. Check with your birthing facility if you have any questions about if nitrous oxide is available, or if they have any certain policies or procedures that you should know about. Thank you for watching this video about using nitrous oxide during labor.